Each year, laser accidents in surgery occur that could have been prevented if the appropriate policies and procedures had been followed. The primary responsibility of the surgical staff is the safety of the patient and the surgical environment. In this section, we will discuss important topics in maintaining a safe environment for laser use. When working in an environment containing surgical smoke, remember, there is no such thing as safe smoke. NIOSH has documented that smoke generated during laser surgery presents a potential health hazard. NIOSH statements about the production of hazardous contaminants into the environment include splatters or droplets produced by high-speed power tools that settle on drapes and then re-enter the air during drape removal, and aerosols produced by lasers or electrocautery. These aerosols remain in the air for up to 10 minutes and may travel through the OR on air currents. Control of airborne contaminants using a smoke evacuator and respiratory protection for surgical staff is based on ANSI standards. OSHA also has guidelines for respiratory protection that recognize the hazardous toxins that staff may be exposed to during the use of lasers and electrocautery and mandates the removal of these contaminants from the atmosphere. Recommended practices by AORN state that plume and other noxious fumes should be evacuated via a filter device. These evacuation systems should be used according to manufacturer recommendations, and that surgical masks for laser use should be worn during plume-producing procedures. Research has proven that smoke produced from a CO2 laser is equivalent to chain smoking 3 cigarettes in 15 minutes. Smoke produced during electrocautery is twice as toxic, equivalent to 6 cigarettes in 15 minutes. Research has also shown that plume contains infectives, including HPV and HIV. The DNA of these diseases have been shown to remain viable in plume. Staff should protect themselves from the hazards of smoke by using high filtration masks and using smoke evacuator units. The eye is extremely sensitive to laser radiation. Even low levels of exposure can lead to permanent optical damage. Reflected radiation, exposure to laser beam, and splash and plume exposure are the main sources of danger to the eye during laser surgery. Appropriate eyewear should be worn at all times during laser use to avoid eye damage. Laser eyewear should be regularly inspected to maintain optimal protection for the wearer. Laser safety glasses are inscribed with the appropriate filtering capabilities and adequate optical densities for the wavelength being used. According to AORN recommended practices, everyone in the nominal hazard zone of laser exposure should wear appropriate eyewear. The operating room in which the laser is being used is considered the nominal hazard zone. Remember to protect the patient. Use proper lubrication and taping of the eyes along with moistened sponges if the laser involves the head and neck area. Safety glasses are to be placed on the patient if the laser surgery to be performed does not include head and neck. Traffic flow into OR suites in which lasers are being used should be limited and doors should be clearly marked with signs. The laser sign should indicate the type and class of laser being used, wavelength, and maximum power. All windows in the OR should be covered. A flame retardant covering is recommended such as a commercially prepared covering. Instrument wrappers are also acceptable. Fabric towels, sheets, and paper should not be used. All surgical staff working with lasers should have competency evaluations and understand the concepts of laser use and the dangers associated with them. Keep in mind these safety considerations to protect yourself and your patient.